The Surgeon General's report focuses a great deal on youth and youth smoking. It actually tells us some very important things. 3,800 kids pick up their first cigarette every day. 90% of people who are adult smokers started smoking before the age of 18. There is evidence of damage to the lungs and heart of an early smoker very early in their smoking history. Within 1, 2, or 3 years of starting smoking, there's some evidence of damage. It also tells us what we need to do to control smoking. We need to make it difficult for young kids to smoke. We need to raise the price so it's difficult for them to buy tobacco. We need to create smoke-free areas so it's difficult for them to consume them. If they actually do find an area where they can smoke, they need to see advertisements, be they billboards or on television, telling people how harmful smoking is. They need to have peers who are actually against smoking and counsel them and indeed encourage them not to smoke. We know that tobacco kills. We know that 30 to 40 years from now, teenagers who start smoking today are going to have chronic obstructive pulmonary disease, cardiac disease, going to have higher risk of 15 different cancers. As we look at the rise in healthcare costs in the United States right now, we know that we're going to have tremendous harm to our economy through the incredible high cost of healthcare. We know that we've saved lives, and we know that we can save more lives. I think we have a moral obligation to work to save those additional lives. I really want every smoker to realize that there is no doubt that tobacco smoking causes 1 out of 2 smokers to die an early death. The other 50% frequently end up with chronic diseases like respiratory diseases and heart disease as well. There is literally nothing to be gained from smoking and a lot to be lost. We must work hard to control smoking, and we must focus those efforts on controlling smoking among teenagers.